So, defibrillator. Defibrillator has two types, biphasic, monophasic. Okay, so how do you know? Number one, if it's the new addition, most probably higher chance is biphasic. But this is an old one. Another one, how you can check is when you push the energy select button, it will have biphasic, if it's biphasic. Okay, but today I just want to demonstrate to you how to handle pedals. Okay, so you on, number one, on. Okay, before that you already initiate your BLS lah. Meaning that you wear your PPE, you check for response, check. Patient responding, call for help, staff nurse, MA, other patient collapse, head chain lift, scan for breathing, no breathing, start CPR. Start CPR. So let's say now the rhythm is you ask the compressor to stop chest compression. You analyze rhythm, VF, continue CPR. I'm going to shock the patient. So you go number 2 first. Okay, so if this is monophasic, you go to 360. 360. Okay. Next is you are going to charging the patient. Continue CPR. So you already select energy, but for practical purposes, I will put it 20. So somebody will apply gel. Okay. Do not charge on the air, and because it might transmit electricity, and especially if there's oxygen, there's chance for convulsion. Okay, then everybody go lah, babung. So continue CPR, gel is applied, relax, and you just continue CPR without interrupting the chest compression. You charge. Charging. Don't worry. Okay. Stop CPR. I'm clear. You clear? Everybody clear?
Clear.
Still VF. Shock. Shock delivered. Continue CPR. Okay, and then you. Okay, this one to minimize risk for accident. Okay, but this guy, the compressor, mesti percaya me lah. Have to believe in me lah. Okay, so 2 minutes up. Okay, stop chest compression. And still VF, yep, still VF, continue CPR. I'm going to shock the patient for the second time. Okay, again, energy select first before you take out the pedal. Okay, I put it 20 for practical purposes. Gel apply, continue CPR, charging. Okay, stop CPR. I'm clear. You clear? Everybody clear?
Yeah.
Still VF, shock. Shock delivered, continue CPR. Okay, so when you go to your new hospital, new clinics, number one, you must know your defib. You must know how to take it out. There are many types of defib, like this and old one. You need to pull it back. Some of the defib is just slide. Some defib on top you need to slide up. So you must know your defib. Alright, understand? Okay. Again, no charging on the air because there's possibility accidentally transmit electrical impulse. Okay, but another strong point is do not stop the chest compression during charging. Okay, only when you want to discharge the shock, you stop the CPR. Okay. Okay. That is number one. And always remember, after you shock the patient, straight away continue CPR. Unless patient opening the eyes and moving the hands, it's another thing. Okay, clear? Number two, when you are going to synchronize cardioverter patient. When you are synchronize cardioverter. So, what rhythm you want? Is this SVT?
Yes.
Huh? Yes. What?
QRS complex, tachycardia.
Tachy, narrow,
QRS.
regular. So let's say patient BP is lowish. Okay. Again, do not straight away synchronize cardioverter the patient. You must tell the patient because this situation is different. Patient is alive. Kan? Patient is alive. Okay, and talking to you. So you call. Better if we address patient by name lah. So you address Encik X, your heart rate is very tachycardic and your BP is dropping. We put current to stabilize your heart rate. Okay, so this is verbal consent. And then you suggest for analgesia and sedation. Okay, patient will agree. Then you ask whether patient have any allergies or not. And then you give sedation. You give your fentanyl and you give your maybe low dose of midazolam. Okay, and then you reassess the patient. Make sure the patient is sedated. How do you reassess? Jangan tunjuk macam ni. Sebab you give low dose, kan you nak bagi dia mamai, dia alert lah balik. Then you have to give more. Okay, you just call. Okay, you call. Encik X. Kan? Tapi janganlah bisik kan. Encik X. And then you may test the eyelash. Eyelash and not eyebrow. Eyelash. Tak, I have to, because I've seen people doing this kan. What are you doing? Test eyelash. Okay, mungkin dia sekolah Melayu lama sangat tu. It's okay. And then you decide for synchronized cardioverter. Synchronized cardioverter. Number one is sync. Okay, how do you know your sync is working? You see the arrow, the mark, Okay, let's say 50. Check boleh Because now I just want to demonstrate how to synchronize cardioverter. Okay, number one patient is sedated. Okay, sync is in line. You choose your energy, gel, and again on the patient. Charging. Okay, I'm clear. You're clear. Everybody clear?
Clear.
Okay. Still SVT. Shock delivered. Check the pulse and get the BP reading. Alright. Okay. Let's say not responding. You assess patient sedated. Of course, you cannot assess the mental status. You look, patient is breathing. What is the BP? Okay, BP is similar, 70/40. Okay. Then you call the patient, Cik Ali. Oh, just now Encik X Okay, Encik X lah. Encik X, okay, is not responding to your voice. You check for eyelash reflex. Okay, still absent. Patient still breathing well. You increase. You make sure you sync and you increase your energy to 100. Okay, let's say this is 100. Gel. Always don't forget about the gel, but don't do this. Just gel, and you might ask your assistant to use the tongue depressor. Rata kanan. Okay. Put on the patient chest and charging. Okay. I'm clear. You clear. Everybody clear?
Yeah.
Okay. Still SVT. Shock delivered. Check back the pulse. And check the BP. Different. If patient in shockable rhythm, I'm clear, you clear, everybody clear, shock delivered, continue CPR. But in unstable tachyarrhythmia, okay, first consent, sedation, charging, I'm clear, you clear, everybody clear, shock delivered, and still tachyarrhythmia, shock delivered, check for pulse. Don't initiate CPR.